Hi, everyone. Thank you for joining us for this week's weekly webinar series. My name is Amanda Robbins, and I am a project manager at the North Sound ACH. Today's webinar is going to be focused on learning more about local impact networks, and we're joined today by Kristin West from the Arcora Foundation. I am going to start today's webinar with a land acknowledgement. But before we do that, I wanted to just cover some logistics. So because there's a lot of us on the line, we've made sure that all participants are muted. This webinar will be recorded and it will be posted on the partner portal for people to look at afterwards and refer back to, or to share with other people who weren't able to attend today. As we go along, if you have any questions, please feel free to chat those into the chat box. We will be monitoring them throughout the presentation, and then we will have some time for question and answer at the end. And any questions that we don't get to, we will be sure to answer them and post them online along with the recordings for you to be able to check back to. And so we'll move on to our land acknowledgement. We begin by acknowledging with humility that the land where we are today is the territory of the people of the Salish Sea. Their presence is imbued in the waterways, shorelines, valleys, and mountains of the traditional homelands of the Coast Salish people since time immemorial. And now I would like to introduce Kristin West. We're really thankful that she was able to join us today and share with folks in our region about the LIN model, the Local Impact Network model. Kristin is a senior program advisor at the Arcora Foundation, where she worked for the past 3 years. At Arcora, she is the one who introduced the Local Impact Network concept and helped to get the oral health LINs up and running in Washington State. Prior to that, Kristin worked for 16 years as the executive director of Choice Regional Health Network, where she provided executive leadership to Healthcare Collaborative in a 5-county region in Western Washington. And during her tenure, Choice worked on programs that reduced the number of uninsured individuals, improved healthcare service quality, reduced health inequity, and improved health outcomes for high-risk individuals. Kristin was also an assistant administrator for the Legislative Relations of Washington State HCA. And in this role, she was a member of the Healthcare Authority's executive management team, and she oversaw communications, including constituent relations and health plan marketing. So Kristin, thank you for joining us. And we will, I'll go ahead and advance Kristin's slides, and Kristin can go ahead and join us.
Hello, can everyone hear me? Great. So why don't you move to my first slide? One of the things I'll say is that I'm relatively new to philanthropy. I've been a regional healthcare network for a number of years. And one of the things that was always elusive to me was figuring out how, for micro issues in a particular area, how you could get them organized into a system of care so that you could take advantage of the changes that were happening. And so when I went to our Arcora Foundation, I've spent quite a bit of time thinking about these local impact networks, because oral health care in particular is 15, 20 years behind medical care. And then in devising this, while you can pick a particular smallish issue, it can be applied to a lot of different forums. And so what I want to do is I want to share some of the things that we've learned. We've been doing this for 1.5 years, but I also want to let you guys know that what I'm hoping is that I'm going to feedback, because this is an experiment. So what we were looking for was an approach to align resources and future navigation, which means we're looking forward, we're not necessarily looking backward. And we want to collaborate for concrete actions and outcomes. Next slide, please. And one of the things I'll say is I believe very much in the evidence, but I also believe in the practicality when you run something locally. There's practicality to the local market that a lot of statewide organizations don't necessarily get. And so while this is an evidence-based effort, it's tied to the rural healthcare component of the Georgia Health Policy Center that went out to a number of rural communities throughout the United States. Communities Joined in Action is a collection of regional healthcare organizations nationwide that have come together and shared practices about what works. What evolved from that is the collective impact efforts that FSG and the Collective Impact Network has put forward from a policy perspective. And then there's collaborative care networks. And then there's the latest addition, which I think is really relevant to the state of Washington, is the development of accountable communities of health, such as Sound ACH. And you're an influencer in how this works. Next slide, please. So I'm going to use some terms that I've kind of developed over time. One of them is micro accelerator. So I see the accountable communities of health, Sound ACH being one, as a macro accelerator, right? You're out there, you're putting the pieces together, you're driving towards pay for value and all this kind of big work with big systems, but there are micro elements in your local markets that aren't able to take advantage of some of these opportunities because they haven't organized themselves into at least a loose system of care. So what we're looking for is it gives separately owned organizations the ability to work collaboratively and achieve a bigger outcome and influence change. So for instance, if you have a small number of nonprofits or small number of organizations that are small in size that haven't formed a system of care, it gives them a chance to come together and see what kind of change they can start to influence. And then that gives them a way to connect to the macro accelerator, such as an ACH. When I say a loose system that is demonstrably sustainable, what I mean is a loose system isn't a separately owned system of care that's put together. It's a loose system of a bunch of different organizations that have come together and are forming a network, but that they've agreed to look at sustainability among themselves in a collaborative way, starting from the very beginning. And it's a way for smaller or individual markets to organize and predictably connect with these much larger regional, state, or national systems. And so I think it's a way for the accountable communities of health to organize some parts of the local system that just hasn't organized yet. Next slide, please. I think the biggest message that I'll send is that it's important to get started. That you can spend a lot of time thinking about this. You can spend a lot of time looking at the evidence, but until you get started and have enough of a framework to get started, you don't know what opportunities exist and you don't know how to communicate that to the organizations that are coming together. So one of the things that I would recommend is that you assign a coordinator, and it makes less relevance to who the coordinator works for, but that you assign someone whose job it is to get up every day and say, this is my job to think about moving this local impact network forward. It doesn't have to be a full-time position. In fact, many times it's a part-time position, but you need somebody who is assigned a certain level of responsibility for it. You need to make it concrete for those who are participating. Most organizations haven't tried to form a local impact network because they have a full-time job and it's serving clients or it's doing a certain function, and coordinating with other organizations may even sound attractive to the leadership of the organization, but they don't have the time or energy. And so you need to make it very concrete what they need to do, and you need to keep it moving quickly so that they can see progress. And the last thing I'll say is you need to keep it very simple, and you need to have it be a way where these organizations can come together and they can check things off of their own personal organizational to-do list in a collaborative way. So you can't say you need to come together because it's the right thing to do for a community. That may be a compelling reason, but you need to help them meet their organizational objectives by them collaborating. Slide, please. So I think the key to the local impact network, and I can talk a lot about this, but I'm just going to go over the high level, and then we can go back if you have related questions, but are the anchor strategies. And I will say that you need to have 6 or 8 anchor strategies that you're going to modify and finalize over probably a 3 to 6 month period of time. And the reason why I say you need to have 6 to 8, and not 1, not 3, is that you need to have the network be large enough that people can come to, an organization can enter it and get their organizational needs met without having it to be their ultimate outcome. And we can talk more about how I've come up with 6 to 8. It's based on some evidence that's proved to be pretty compelling, but that's what we find, is that there's 6 to 8 related anchor strategies to modify and finalize. And then you go out and you identify the biggest contributor, either the current market, or there's a positive ability to benefit an organization, right? So for instance, with the oral health local impact network in Spokane, the behavioral health organization, the major behavioral health organization there, had a lot of clients that had oral health needs that they just weren't even asking what they were because they didn't know how to get them into a dentist. And we were able to say, if you come up with, a patient navigator position, we can connect them to dental care. And they realized that it was such an unmet need. Now that they have a solution for their unmet need, they're moving forward with this, with an anchor strategy to have someone who's a resource navigator. You need to have individual dialogues with the key players. So you go out there, you identify a potential anchor strategy lead organization that's local, and then you sit down with them and you talk about what the anchor strategy looks like. And this is where the anchor strategy will take on its most compelling modifications. So for instance, in Spokane, for the oral health local impact network, for the access to care anchor strategy, we're looking at adults and oral health, adults with diabetes or are pregnant. And then in Thurston County, for the local impact network, they're looking at seniors that are uninsured. And so while it's still adults, they have a different market because of what their data says is the compelling need. And they can build out that over time, but that's where they're starting. And then you develop one common outcome for all anchor strategies to achieve, and a big goal, almost a campaign type goal, almost a stretch goal. And what we have chosen for our anchor, our one common outcome for all anchor strategies across the oral health local impact networks is we're trying to prove if you undertake 6 to 8 anchor strategies to reduce health disparity, oral health disparities, that it will impact overall health equity. And so that's the evaluation we looked for. That's the level of anchor strategies that we're undertaking, and we're starting to see some positive impact in that regard, and we're starting to see some things that don't work as well. So that's the kind of stretch goal or campaign type goal that you want to have available. And then you want to identify other organizations to participate in each anchor strategy as sub-strategies. And some organizations will be in multiple anchor strategies. They won't maybe be in all 6 to 8, but they may be in 2 or 3. So those are smaller organizations. They're organizations that serve maybe even statewide, like a health plan or a health system. But there are some, so that's what you put together. So you get the anchor strategy leads to come together, and then they put together their sub-strategies within their anchor strategy. And then one of the things that has to happen probably at the 3 to 6 month level is that the anchor strategy lead organization needs to complete a budget. What are they going to undertake as a result of this? And with individual outcomes and inputs. So what are the anchor strategy level outcomes and outputs? And I can say one of the things that I've learned, at least with the local impact networks we've started so far, is that this takes quite a bit more time than we had originally thought. So that's one thing I'll talk about a little bit more, is how do you get some traction for this, because I think it's really key to the local impact network. And you form a coordinating entity. There needs to be a backbone organization and collective impact language. There needs to be someone who, the coordinator starts out creating it, but there needs to be a level of governance that takes place. And you need someone, and you need a series of decision makers at the table who are moving the work forward in a compelling way, and they're looking at outcomes for the other anchor strategies, not just their own anchor strategy. And then the other thing that I think is unique to probably healthcare, and I'll define that largely, any clinical input, is that you need to have a clinical implementation committee that includes whoever the clinicians are that are providing the care. And you probably need to have them meet separately, because if they're seeing patients during the day, they'll need to meet in the evenings. They'll have a different way of talking to each other, but yet you need them connected to the coordinating entity. So you'll need to figure out a way to have some cross-representation of the clinical implementation committee with whoever the coordinating entity is. And I can tell you the different ways the local impact networks for oral health have approached this. It's been kind of a unique difference for each one, but that's the general overview of how it works. And then what you need to do, lastly but not leastly, is you need to have a network performance measures. How do you know that the network is making a difference? And you need to have a way of communicating that and looking at that and moving your strategies forward. Next slide, please. So I'm just gonna, this didn't come up quite right, but so this is how you get started. This is the visual that it's messy. It's got lots of different organizations, and I'll say that while I've made this general for this audience, you'll have the specific local public health jurisdiction in there. You'll have the specific housing providers, and the darker circles are the local resources that are at the table, and the lighter circles are our philanthropic contribution. So these are the things that we're offering up to these specific anchor strategies, in hopes that these local resources will come forward and participate. Next slide, please. And the thing that we have found to have present from the beginning, and I'll say that while we started this in Spokane, we didn't have this all thought through. So this isn't necessarily the way it worked in Spokane, but we've gone back and we've added things as it's developed. And I would really encourage, again, it's the get started mentality. But you need to move from a coordinator to having an actual network manager. And you need to have a way to purposefully evolve. Either the coordinator becomes a network manager, or you need to hire a local network manager, but you need someone locally who is moving the network forward. You need to have a lead coordinating entity and a clinical implementation committee that meets regularly. And beyond meeting regularly, it needs to begin to govern. So, for instance, what I'll say is, as one of the major investors in the oral health local impact networks, I'll show up at the table at a local coordinating entity, but I'm one of 12 or 14 votes. I'm not the vote, right? So that's what I mean by govern, is it starts to develop a sense of governance locally, but it has relative influence and an agenda from either in our case, an oral health funder, but in other cases, it could be multiple funders, right? You need to have 6 to 8 concrete anchor strategies, and the lead coordinating entity is collaboratively embracing and trying these activities. So what you don't want to do is you don't want to have each anchor strategy show up and they present what they're doing, and then for the rest of the meeting, they're not contributing anything because they're like, I don't know how I fit into the other anchor strategies. There needs to be a way that they can collaboratively embrace and try different things, even if they're not putting resources for a particular anchor strategy. There's a collective wisdom in the room that can be tapped and that they're encouraged to share. And it takes a purposeful effort to get to that place. The key thing is you need an evaluation framework and you need the data collection that drives the work ahead. And this is different than an evaluation that looks at things for the past 5 years and makes a determination that for the next 5 years you should do X, Y, or Z. This is real-time data collection that you look at every other month. We have dashboards. I should have put a dashboard up here where it shows for each of the anchor strategies, you know, how things are going, how things are working. And you may look at it and say, wow, we didn't expect that. Maybe we should change our strategy to focus more on this. And so it's a real-time evolving strategy that moves the work ahead. The next tier, integrated work, and this is kind of hard because when you're getting started, it seems so big to have 6 to 8 anchor strategies that you're focused on. But this is the work of the network manager. And this is what I say, the network manager needs to be 1 or 2 steps ahead of where the network is, and is introducing what are the next tier. And the next tier of activities tend to be things that are integrated, right? So they tend to be things like 2 anchor strategies will be like, wow, we could do this together. If you put this resource forward and I put this resource forward, we could move forward on this. And so those are the things that evolve out of getting started. And it's amazing to me how once that starts, you have to pick and choose which strategies to undertake. But there's a level of once a network takes off, that there's this integrated way that it moves forward. And then the last thing that I think is super, super important is a purposeful way to keep strong communication among all the players happening in real time. And that's something that you need to have your network manager build in a concrete way into the network, because all of these people, they'll leave the meeting, they go and they do their day jobs, but they're not necessarily focused on the new network that's forming, and they need to be in between meetings, and you need to keep the communication live. Next slide, please. The key things that I found to be aware of, and I'll be interested in your questions about this, but is you need to have a purposeful strategy to move from a coordinator to a network manager. I think that's, we found that to be extremely relevant. We started out with a coordinator from the foundation. That's a statewide foundation. And we didn't put enough energy into finding a local network manager. This is in Spokane. And so then we had to go back, and now we're finding a local network manager. And we started out with a local network manager in Thurston County, and it's made a huge difference. So that's something that I would be very mindful of. You need to find an integrated set of anchor strategies that begins to form a network over time. So the right set of anchor strategies really needs enough time and thought. And the reason why is it needs to be a compelling reason for people to come together over a period of time, and they need to see the reason why they're coming together. And I can tell you that the data will inform that, but people that are participating in the network, they'll know if you pick the right anchor strategies. And there's a combination of local people picking them, and a regional accountable community of health and investors. There needs to be a lot of dialogue about that. You need to launch it quickly. which is what we did in Spokane and Thurston County. But one of the things that I would do differently is bringing in different types of multiple investors almost from the beginning. I wouldn't have a sole funder if there's any way to avoid that. And what I would do is I would count what anchor strategy lead organizations are bringing to the table, right? And I would count how the resources are being put on the table in a different way, so that it looks like it's the multi-investment approach is really apparent. The other thing is forcing the sustainability question from the beginning and throughout. We say that we're a 3 to 5 year investor. We don't know if that's right or not, but that's what we're saying right now. But if you don't start the sustainability question from the day that you start funding the organizations, it becomes too hard to evolve it, because the revenue streams are difficult to figure out. And I'll say that this will even change as the anchor strategy progresses, but it's something that deserves a good amount of thought. Moving past grant reporting out and having authentic dialogues. And what I mean by that is, you'll have 6 to 8 anchor strategies. They're getting a grant investment from one or more organization. And so the incentive is for an anchor strategy to present how they're doing and the other anchor strategies to sit quietly, because there is a vested practicality in negotiating what you're doing with the funder versus sitting at the table, looking at each other in the eye and having aligned accountability. And that's what that's what the network manager has to work on have happen. That's what I call the awkward phase. There will be a time when the local organizations, there'll be a resistance to moving to cross accountability, and the network manager needs to know how to remain purposeful and present in that conversation and move that forward in a real way, both for the coordinating entity and the clinical implementation committee. And that will be key to the local impact network's level of engagement over time. And we can talk about some ways that you can achieve that. And then the last thing to be aware of is keep key decisions made collaboratively by the coordinated entity. Make sure that the network manager isn't having one-on-one conversations with different members of the network and then coming forward and saying, this is what we decided. Make sure that that the network manager is teeing up the conversation to happen among the governance structure of the coordinated entity, because that's what builds local governance. And then my last slide. So I'm super interested in your questions, and I'll turn it over to Amanda at this point.
So you can go ahead and chat in any questions you have into the chat box, and then we will be sure to ask those of Kristin. Kristin, as I was listening, I had a question for you actually. Thinking about the order of operations in identifying anchor strategies or convening a LIN, do you think that the anchor strategy groundwork should be done by the coordinator of the LIN and identifying those anchor strategies and then trying to bring people in around those strategies? Or do you think it's better to bring in the players you think are the right people and use their expertise to generate some anchor strategies?
So I'll tell you what I found. I have found that because this is a micro accelerator and not a macro accelerator, I think with a macro accelerator like a Sound ACH, there's enough incentive on the table for people to develop their own anchor strategies. But with a micro accelerator, people are too, or organizations are too busy, and even if they want to find a solution, they just don't have the time. And so I think the key is to have it co-developed. So I think it'd be good for you guys to develop anchor strategies, but not get so wedded to them when you take them out that you're not willing to say, oh, that doesn't make sense, but this makes sense, right? You need to present a framework for organizations to respond to, is the best that I can answer that.
Great. I think that's helpful. And we had a question come in to the admin account that was asking for some examples that you know of where local impact networks have been used outside of the dental sphere.
So I don't have a local impact network example. So the way that the local impact network concept was started was with Washington nonprofits. And I was put in charge of a local impact network for healthcare, and there was another one for, I believe it was housing and homeless, and there was another one for, I think it was school-based efforts. And we were testing this concept. And I don't know where they've ended up because they had a change in leadership. But that was the concept, is we weren't looking at local impact networks specifically for healthcare or even specifically for oral health. It's the framework I used to design one for health. But I can tell you that there are a lot of examples of local impact network types of organizations that have formed for other issues. And I'd be happy to share some examples of, let me think of one. I'll tell you one that started, and I think this will be relevant to this group here is, so this is part of the Spokane Local Impact Network. One of the things that we've done is we've tied it to the Accountable Community of Health, Better Health Together. And so therefore the opioid strategy lead for the local impact network is the same organization as lead for Better Health Together. And what they have done is they've taken the local impact network approach towards looking at the opioid issue. So where the local impact network comes into play is, how do you get dentists involved? Because dentists are one of the first prescribers of prescription medications. They're loosely organized, if even organized, and medical care is further along. So there needs to be a way to get to dentists, but that's, while there's a local impact network approach towards that, it ties into the larger strategy of the Accountable Community of Health.
Great, thank you. I think that's sort of a encapsulation of the ACH and how all of our strategies really overlap and impact each other to improve care regionally. We had another question come in that was asking about trying to manage disparate priorities amongst partners in a LIN, and I guess how you do that when you have collaborative decision making, but you have people who in their, outside of the LIN have different priorities, and how you manage that.
Yeah, it's a fundamental question, right? So you'll have large organizations that are like, why would I want to show up to a local network of folks and be accountable when I can just make, decisions based on my organization because they're not dependent upon the other smaller organizations. And I think what you need to do is you just need to keep finding ways. I'm not interested in participating means you just haven't said yes yet, right? So you need to keep finding ways to involve them. And then the other key thing that I'll say, and we haven't quite figured it out yet. We have two different ways that we're looking at it, but you need to have, I'll say this, you need to have the decision maker for the anchor strategies extremely relevant participants in the local impact network, even if they aren't coming, even if they assign someone else to go to the coordinating entity that they need. Yeah, so we have people at different levels in the organization that are participating, but we're trying to figure out how do you get their level of participation to be relevant so that they can speak for the organization. And I think that's key.
Great. Thank you, Kristin. Sounds like maybe you have some squirrels running by the window or something. That is all the questions that have been chatted in. If you have any questions for follow-up for Kristin or for our team, our contact information is here. Please feel free to reach out to any of us via phone or email. And then as you share this presentation with other folks in your agency who maybe weren't able to join us today, please know that they are welcome to reach out to us as well. Our last slide here is just a notification of our upcoming webinars. And so we will be continuing our webinar series with presentations on July 10th, 17th, and 24th at our regular time, Wednesdays at 10 a.m. And you'll receive a calendar invite the week prior to let you know the topic for that week. And so that is all we have today, unless anyone has some last minute questions. But Kristin, I just really want to thank you for joining us and sharing that information about how to get a LIN started and really the important work that it can accomplish in moving these metrics forward for our region.
Yeah, I want to say we're it's kind of an experiment. So call me, anytime if you have any questions. Share your, if you start one, share what's going on with your local impact network, and let's consider this a partnership. Thanks.
Great. Thanks so much.